4, 3, 2, 1.
Hello and welcome to Southeastern Health's Healthy Connection radio program. I'm your host, Amanda Crabtree, and we are here on the fourth Wednesday of each month at noon. We are broadcasting live from the Nelson & Nelson building, and callers, if you have a question about our program today, you can call in at 910-739-1341. We are delighted today to have in studio two guests. We have Southeastern Health Foundation Annual Giving Specialist, Ms. Heather Walters. Welcome, Heather.
Thank you. Thank you for having us come in today.
And we have SRMC Gift Shop Coordinator, who also happens to be a co-chair of the Southeastern Health Foundation Gala this year, Ms. Bonnie Biggs. Welcome, Bonnie.
Thank you so much.
And we also have on the phone today our Southeastern Health Behavioral Health Care Services Director, Mr. Anthony Grimaldi. Welcome, Anthony.
Thank you. Good afternoon.
Thanks for joining us by phone. And today you're wondering, well, what do all these folks have to do with one another, I'm sure. So this year, the Southeastern Health Foundation's Gala is going to shine a spotlight on behavioral health. And actually their theme is Shining a Light on Behavioral Health, Gala of Grateful Giving. And so Heather's going to talk from a foundation standpoint. Bonnie is going to talk from a community, behavioral health, what that means for families, and Gala aspect. And then Anthony's going to talk to us about what services Southeastern Health offers for those folks who need those services. And also our magazine that's coming out in February, HealthWise magazine, is going to feature an article about these services and also profile our gala. So we've got lots coming up. We're excited about this opportunity. So Heather, if you would start off and tell us just a little bit about what this gala is, and then we can go into the beneficiary this year.
I'd love to. Thank you. Since 1993, the Foundation Gala has contributed more than $1.7 million to advance and promote Southeastern Health and the services we provide. The annual gala brings a diverse group throughout our county and regional community together for an elegant evening affair. And this year we believe we will easily exceed 600 guests, so we're very excited about that. As a nonprofit hospital and foundation, we depend greatly on the support of our community. Through the contributions of our community, our donors become a vital part of the healthcare team by providing resources that otherwise would not be available. And that is really what the foundation is founded on, is that we are the biggest supporter of Southeastern Health, and we've been brought together to organize community efforts to assist in the growth and development and the quality health care that that's provided at Southeastern Health. We are grateful that we were able to have Bonnie and Kenny as well as Chelsea join us as gala chairs and our gala committee, who from throughout the county join us to ensure that the 26th annual gala continues to be an elegant black tie affair that's memorable, with great emphasis on expanding and enhancing the care of behavioral health patients in our community, which we all know is a great need, which Bonnie and Anthony will be able to speak to better.
So Bonnie, when the committee met, I'm sure every year it's a big decision. Well, who, is going to be our beneficiary this year? And there's been a number of wonderful causes. As Heather mentioned, this is the 26th year, and every year there's a cause because there is a need. And so talk to us a little bit about how that decision was made to focus this year on behavioral health care.
Well, I think we've received a grant. Anthony can speak more to that, but the hospital has recognized there's been a huge deficit in funding and education and support for our behavioral health patients. We see an enormous influx, and certainly that Anthony will speak more to the volumes and numbers, but when I was approached to consider being a gala chair, it was one of those moments that I didn't hesitate. Normally I have to stop and think about something, and I had a lot of things going on at the time with a family member passing away, and it just came out yes before I even knew it. So I knew that there was a reason to go forward with my passion. in supporting this. I've had personal connection to behavioral health within this county for over 25 years. I have tried to learn the navigation process for a lot of roadblocks that occur for families and how to receive treatments, the organizations that are available, and what I've learned is that there are very limited resources, but there's also very limited education. And I think from my perspective as a family member, families need to be educated on what they can expect. I've worked with Anthony. We've done a video that is designed to educate families before they arrive onto the unit at the hospital, so they understand why we have the protocols that we have, why things are the way they are. One of the quotes that I'm going to steal from Anthony it's very true. We as family members get caught into this cycle of trying to do what you think your family member wants, you're going to give them, what they want to help them get well or get better, but you actually have to be careful of that and only give them what they need, because you get caught in this rotating cycle. And families don't understand terminologies like IVC and what that means. And I feel that this is an opportunity to use our services at the hospital through Anthony's leadership to educate families and teach them. Also, I want to push this on out into the first responders that, that encounter a lot of these patients, and have them have an opportunity to understand how maybe you speak to families, how you speak to the patient who's about to be IVC'd at the hospital.
And that's involuntarily committed.
Involuntary, right. And I think that's important that we understand there's a way and a process. Sometimes their first responders have no resource, but folks are tased. And that's not a fun thing. But there are people who can be approached differently if perhaps we've helped provide tools for them to be educated and they come on board with this. That's my hope as a family member.
Okay, great. We're going to anyone that's just joining us, we're talking today with Bonnie Biggs. She happens to be the gift shop coordinator at Southeastern Regional Medical Center, but for now, the role that she is filling is Southeastern Health Foundation Gala co-chair. We're also joined in studio with Heather Walters. She's the Foundation Annual Giving Specialist. And so Anthony Grimaldi is joining us through our phone line, and he is the Behavioral Health Services Director for Southeastern Health. Anthony, we've heard from Heather about what the gala is and from Ms. Biggs about why it's important for family members to help educate people about behavioral health services. If you would, tell us a little bit about the scope of what Southeastern Health offers, and then we'll go into this funding, what that will be used for.
Sure. And I want to kind of echo what Bonnie was saying about educating families. We often hear that heart disease is a silent killer. Behavioral health illnesses, psychiatric disorders, and substance abuse disorders are secret killers. And what we mean by that is we don't talk and educate our communities and family members to the impact of these illnesses. And even many healthcare systems kind of push it off to the side. One of the reasons why I was so excited that the committee graciously decided to focus their energy and efforts this year on funding resources for behavioral health is it's just two things. It's not just about the money. It's about an acknowledgement as a delivery system, as a healthcare delivery system, that we understand that mental health and behavioral health disorders are secret killers, and we need to bring that into the forefront and begin talking about it and educating people about it. So I think there's two great things that are happening here with this gala. One, obviously, is the funding resources that will help us enhance some of our programs, but two is we're bringing light to something that's been kept in the dark too long. Just to give you an example, at our hospital, probably most people don't realize this, 25%, 1 out of every 4 patients that is admitted to our hospital also has a behavioral health and or substance use disorder that's impacting their ability to reach their maximum potential and treat whatever other co-occurring disease that they might have been admitted to the hospital for. 40%, almost 1 out of every 2 of our patients that are admitted to our hospital readmitted to our hospital has a behavioral health or substance use disorder. There's just staggering numbers. There's been an awful lot of attention recently to the opioid crisis that we're having, and I'm glad we're spending putting attention to this, but it's just one of many illnesses that we are dealing with in the behavioral health realm. At Southeastern right now, currently we're operating a 26-bed unit as well as an outpatient service, managing psychiatric services in the emergency room, as well as providing consults to the medical floors with two psychiatrists, 5 mid-level nurse practitioners, and we're hiring a 3rd psychiatrist as we speak, because the need is just overwhelming what we've been providing. We're also providing what we call a paramedic mental health partnership program, where we go into patients' homes post-discharge with a paramedic and with a social worker, and soon to be with our residents, with our resident program, to assist these patients in getting reacclimated to their home environment, make sure they have their medications, are not in crisis, and have the resources they need to stay home and not re-enter the hospital. So we're just an unbelievably busy system. And as our head psychiatrist, Dr. Saini, is always saying, we need to remember that the head is connected to the body. You can't treat medical problems without recognizing that many times folks also have a behavioral health disorder, whether it be depression, anxiety, bipolar, addiction, sometimes schizophrenia, that needs to also be treated at the same time that we're treating the medical condition of our patients.
Very important. Thank you, Anthony. And if you would, talk a little bit about what the plans are for the funds that will be raised through the gala this year.
Yeah, we are, like I said, bursting at the seams that we've been awarded some money to assist us in opening up a new additional psychiatric unit, 10 to 16 beds. That'll be on 1 East. Currently, our psychiatric unit is on 3 East. So we'll be expanding our operations mid-year this year to open up a med-psych unit where a hospitalist and a psychiatrist will co-manage patients that have psychiatric and medical problems at the same time. It'll be the first of our kind in our region. We're also opening up services to better serve the geriatric population, as our elderly folks also are suffering from similar illnesses but have different distinct needs. And part of what we want to do with the funds that are raised is to not only bring some technology services like telepsychiatry to our delivery system that allows us to reach people in their homes, possibly before crisis, but also to add an outdoor therapeutic delivery system. And what I mean by that is take a courtyard that we currently barely or underutilized in our hospital and literally connect it to our inpatient 1 East floor, so that patients have the ability to go in and out whenever they need to, provide outdoor services like Tai Chi, yoga, exercise therapy, gardening, horticultural services, meditation gardening, et cetera. And again, nothing like this exists in our region. Some other states require that you have an outdoor therapy area. North Carolina doesn't, but we're taking control of what we believe is a significant need, which should allow folks to both relax indoor and be treated outdoors at the same time. So much of the funds are going to go to what I would like to affectionately call a recovery garden and a recovery therapy activity area outside of the hospital, but connected to our unit.
That's great. And a lot of times I don't think we think about people having multiple issues in addition to a health crisis. They may also be dealing with a mental health issue. And so it sounds like this is something that's very much needed to handle both of those issues that are occurring for many people at the same time.
That's correct. I think, like I said, I call it the secret killer. Patients are embarrassed to talk about it. Family members are not educated. Doctors don't necessarily know what to look for. And the patients go undiagnosed or untreated for their mental health problem. And if you think about it, if somebody's not operating at their maximum capacity emotionally, behaviorally, and cognitively, how difficult it now becomes for them to manage another chronic disease, whether it be heart disease, obesity, diabetes, COPD, etc. So, and then we wonder why folks come back to the hospital. It's because it's so complicated to manage both illnesses by yourself, without a support system or without professionals on your side.
And this Southeastern Health Foundation Gala is giving us an opportunity, even through this show, to help raise awareness for these services. So if someone's listening who may have a behavioral health issue, Anthony, or to have a family member and they just aren't quite sure how to access the services, what's that first step that they can take?
So the first step is obviously for the family members to talk to their loved one and acknowledge that they realize that they're struggling. So we've got resources in the community and the hospital. We've got mobile crisis that folks can call. And we put that number out on our website. They can also call our hospital. And the number there would be 910-671-3030 for our outpatient program. And if it's obviously a medical emergency, people can also come to the emergency room. You know, I often say the emergency room is the worst place for somebody with a mental health disorder to be in. There's just too much activity going on. And it's so sad that we couldn't engage that person earlier through their primary care doctor or through mobile crisis or through an outpatient provider. That really needs to be the goal. Any of us that have been in an emergency room know that it's the worst place for all of us to be, and if it could be avoided,
Right.
you know, we should. So I hate to say that the emergency room is the first place you should go to, but it absolutely is a resource of the last resort.
Right, and you really should bring it up to your primary care physician. The number again to that Southeastern Psychiatry Clinic is 910-272-3030, and that is affiliated with Southeastern Health, and that is where a number of folks are located where they can provide outpatient help as well.
Correct.
Anthony, we're going to let you go. Thank you so much for joining us via the phone line. That was Anthony Grimaldi. He is Southeastern Health Behavioral Health Services Director. Thank you for joining us, and we're going to continue the program in studio with Heather and Miss Biggs. Thank you, Anthony. Okay. So we've heard about behavioral health. We've heard about that obviously there is a huge opportunity for education. So let's transition into some details about this event. So if anyone listening, behavioral health is close to their heart, they want to find a way to help, they can support it through buying tickets for this event and have a wonderful evening out. So Heather, tell us some of the details about this year's gala.
Yes, please consider joining us for our 26th annual Gala of Grateful Giving presented by Robbins & Morton. A presenting sponsorship was newly added this year, so we are grateful for the support of Robbins & Morton. And join us in shining a light on behavioral health. We are taking great care to make sure that we have a wonderful evening, but also there's moments of meaningfulness, whether it's through a quote you might see on a screen, or just knowing that we might have phone numbers that you might otherwise not know or want to ask for. We're going to have those prominently displayed in various areas throughout the gala. Our gala is Friday, February 23rd at the Southeastern Agriculture Center here in Lumberton. For information about attending, you can call the Foundation office at 910-671-5583 or email us at foundation@southeasternhealth.org. Again, that's 910-671-5583 or foundation@southeasternhealth.org. And if you are unable to attend, you can still donate to these efforts to enhance the expansion of behavioral health. The grant was a huge success, a huge win for the team of people who write the grants for Southeastern Health. And we are just, adding on to, the funds that they have helped secure from the state through the grant. But we hope to have a record-breaking gala success with funds raised, funds given, and attendance. So please join us, or please consider making a donation.
And it's a black tie event, and it
Yes.
occurred to me, wouldn't that be a wonderful Valentine's Day gift for someone to give their sweetheart tickets to the gala.
That's right.
So that just kind of came to me. I thought that might be neat because you
That's
get
right.
to get dressed up and have a night out. Might
That's
need
right.
a date night, and all the while you're supporting a wonderful cause. So that may be something our listeners want to consider. So the number. Yeah,
At
go ahead.
the event, you'll also have opportunities to continue to support the efforts through fundraising, through an art auction, where we have asked various local artists throughout the region to please donate a piece of their beautiful artwork to join our efforts to raise awareness and funds for behavioral health. And we have had great success with anybody that we've asked. And we also will have a wine pool where people will have the opportunity to draw for a random selection of a fine wine
Great. Okay.
as well.
Okay, so that number again, if you're interested in tickets or more information, that number is 910-671-5583, or you can email foundation@southeasternhealth.org. Bonnie, the decision to be a co-chair is a family decision. It's not only you and your husband, but also your daughter. Tell us a little bit about what your role involves and sort of as an ambassador for this event.
Well, when I was approached, as I said yes immediately,
Right.
and at the same time, the theme for the gala just literally came out of my mouth at the same time, that I somehow subconsciously must have been thinking about a gala theme without realizing it, and that's where the Shine a Light opportunity was presented to Sissy and Heather and their team, and we really have focused on that. Anthony spoke to that about shining a light, and I think having lived through this as a family, and as you said, this is a family thing that we are doing together, because it does affect families. You have someone in your family who has a behavioral health issue. I lost a nephew as a result of behavioral health issues. So we were all affected by this. Chelsea was very close with her cousin, and it affected her greatly. She has always understood that this is a disease state, and we haven't hid that in our family. So for me to be a part of something that's going to shine a light on it within the community, and I understand families approach things differently, and they hold it close to their chest, they don't talk about it, they don't share, and that's perfectly understandable and works for them. In our family, we talk about things and we do shine lights on it, and I hoped, and as I've done that throughout all these years, I've encountered so many people that have approached me and said, I have this loved one that these things are happening, and I don't even know how to navigate the system, and I am happy to say that I've been able to assist them in how, and organizations that are out there, that will help them. My loved one has been involved with an ACT team that is a multifaceted care team that has a psychiatrist, a nurse, and a coordinator of healthcare issues, doctor visits and stuff. And that's been essential. A lot of folks I've spoken to didn't even know a team like that existed. So I think that we have an opportunity to present that this is a real thing. It happens to all families. And I love that Heather and Sissy and Renee and Dee have embraced this theme. Much to my OCD side, I will admit, because I get these ideas and this passion comes out. But it's not about, and we're doing it very thriftily and very frugally, and people have donated things just for this particular night, so we're going to be very careful about keeping the net profit the most that it can be. Yes, we want it to be a lovely event, but the whole idea is having light, and that's going to be a theme that you will engage and encounter in from the minute you arrive on the property. And that I'm very excited about, that we've been able to embrace this theme, and my family has been able to be a part of this as a family. So I'm very happy about that.
Heather, if you would, remind our listeners of the details again, when and where, and how to get more information in case this has piqued their interest and they want to support this wonderful cause.
I'd be glad to. The Southeastern Health Foundation Gala of Grateful Giving, presented by Robbins and Morton, Shine a Light on Behavioral Health, is Friday, February 23rd at the Southeastern Agriculture Center here in Lumberton. And the event, the evening will begin at 7 p.m. If you are interested in attending or making a donation towards our efforts, you can call at 910-671-5583 or email us at foundation@southeasternhealth.org.
And let's also mention the committee, because behind Bonnie and Kenny and Chelsea are a
Yes.
committee of folks who gathered months ago and started
Yes.
planning.
They are very excited. We have a large gala committee that we have made special effort to make sure that all areas of our community are involved. And that's the way the Foundation Gala Committee has always been. They are all doing extra special things to help make the evening just that, extra special.
Great. And we appreciate the foundation and their causes and their events. And I know you had a Boots and Barbecue, and we have the gala coming up, and there's the annual golf tournament. So you can
Yes.
always count on them for helping to support great causes in our community. So, and also for our listeners, I want to repeat the phone number that Anthony shared in case the issue of behavioral health has piqued someone's interest and they may not realize there are a number of local resources. That number again to Southeastern Psychiatry Clinic is 910-272-3030, and that can be a gateway to getting more information. And as we mentioned before, talk to your primary care physician. It's not just about your physical health, it's about your mental health. And so don't be afraid to speak up. And Bonnie, when you were talking, I thought about, isn't it amazing how when you start talking about your experience, people start becoming comfortable that they find that
That's right.
it's not just me or it's not just my family.
That's right.
Yeah.
That's right, and that's been really interesting over the years of this, and I've actually been approached by all socioeconomic friends of mine, and I've been happy to help them navigate, because it is a navigation of the system, and that's what we've got to improve. And Anthony has set up a wonderful resource opportunity for us to be able to help and assist people, and I'm very happy about that.
And Heather, people can purchase tickets individually or can purchase a table for like a corporate group, is that correct?
We currently have individual as well as couple
Okay.
tickets available.
Okay.
We have, I think, sold out.
Maxed out on your
Yes.
on your table.
For
just
our
for
tables,
taping.
but don't let that keep
Yeah.
you from joining us. Please come.
'Cause no one
and join
sits
us.
down that
Yes.
night.
I
Not for
believe
long.
I
Not for
haven't,
long.
sat down at a gala in years.
Yeah. And there's a live band.
Yes,
correct?
Liquid Pleasure,
Dancing.
which is brought to us for the evening by Campbell University, and their
A fun band, a
Yes.
very fun band.
Campbell University is our band sponsors this year. It will be a wonderful evening. We have local caterers who are coming in to help us for the evening. So look forward to a great time helping our efforts to enhance our behavioral health area. And thank you to the grant writing team and the leadership of Jason Cox, as well as Anthony Grimaldi, Reed Caldwell, Sissy Grantham. We are very excited, Bonnie and I. This will be my first gala as the annual giving specialist.
But you have been involved as a
Yes.
board member in the past. So
And been a
you're
gala
not-
chair
Yes,
herself.
That's
yes.
right.
So you have lots of experience.
But I'm very thankful to have Bonnie and Kenny and Chelsea and their passion. It's making lots of fun.
Yeah. So, thank you both for being with us today. We've been talking with Heather Walters. She is the Southeastern Health Foundation Annual Giving Specialist, as well as Bonnie Biggs, who is the Southeastern Health Foundation Gala Co-Chair, as well as the gift shop coordinator for Southeastern Regional Medical Center. So we'll plug that real quick. If
Thank
you need
you.
a gift,
I know.
stop by the
There's
gift shop
lots
and
of
see
great
Bonnie's
things at the
place.
gift shop.
The gift shop sponsors the valet program at the hospital, so
That's right.
by shopping with us in the gift shop, you're actually sponsoring the valet program, which is a wonderful service to offer people to come. And we have a parking challenge on site, so you can come and use that service for free.
And I've heard it referred to as the best kept secret in Lumberton for gift shop shopping. So don't forget that there at the hospital. It's on the
Thank
main just off the main lobby as you enter the hospital. And then earlier we were joined by Anthony Grimaldi, who is the Behavioral Health Services Director for Southeastern Health. So just want to give out 2 phone numbers as we wrap up. If you want to access behavioral health services in the community, you can call 910-272-3030. That is to Southeastern Psychiatry Clinic. If you're interested in more information about the gala, or if you just want to make a donation to the foundation, that number is 910-671-5583. Thank you for joining us today for Southeastern Health's Healthy Connection.